Thank you, Speaker. My question is to the Minister for Health. Minister, I know you're aware of the growth of Wollondilly and I appreciate your support for Bowral Hospital to date. However, my electorate is very large and the growth around Wilton stretches to Appin, and it'll see 30,000 new homes built over the next few decades. Will you support my call for a new health hub to be established at Wilton?
I call the Minister for Health.
Thanks, Mr Speaker. It's a very good question. I've had an opportunity both as the Shadow Minister and as the Minister to engage directly with the local member. I know she's a very tireless advocate for that part of New South Wales, and we are seeing very, very strong growth. When I looked at the figures recently, I think I met your Mayor recently, and between now and 2021 and 2041, there was around about 50,000, or will be around about 50,000 additional people coming into your local government area. That is an enormous amount. That is not growth that we see in every local government area. It's not the sort of growth in my local government area in Wollongong, but it is the sort of growth area on the fringes of Sydney, and we need to keep up with that. What we are doing is a number of different things in relation to health services for your community, and we've got more to do. We have allocated around, Mr Speaker, $15 million for planning of a new hospital in the Aerotropolis area. That is an important part of reserving where that is going to go and identifying the best location for that, alongside the work that the Minister for Planning and others are doing in that space. Mr Speaker, in relation to the health hubs, I should firstly say what they are to members. They are essentially one-stop shops for health services that we think can be done outside the hospital setting to try and avoid everybody going into the hospital. So it's often for outpatient clinics, primary health care, those subacute types of areas where we can get people clinically well and better, particularly people who have to access healthcare at frequent intervals, but they're not forced to go into a busy hospital system. Now, your local hospital or one of your local hospitals in that part of the world is Campbelltown, and you will know better than anyone, and members in this place who that hospital services will know that that is one of the busiest hospitals in the country. Last year, in the last 3 years, it was actually the busiest hospital in New South Wales. It sees about 90,000 ED presentations a year and growing. So what that means for communities like Wilton is big demands when they are forced to go into that hospital to access care. I can report to the member in the House that I've asked New South Wales Health and Southwestern Sydney Local Health District to do a piece of work on integrated health hubs for consideration going forward in terms of investment. Now, we're not at a timing yet where we can...
Yes, member for Wollondilly. Additional 2 minutes is granted, Minister.
We're not at a period yet where we can announce and commit to that, because that work is still underdone. But I want to assure the member and her community on a number of things. We've heard that message loud and clear about demand for services in South West. I've had a careful look at the integrated health model. I've asked other former ministers of all political persuasions about their efficacy and the way in which they work and the advantages to growing communities. We generally do these in growing communities where the growth has not been significant enough at the point in time to do a full-scale hospital, but it has been to take some pressure off the existing facilities. And that's what we are looking to do at South West. Now, there's work to do here. There's a range of different sites, including the one at Wilton. I want to assure the member that we are carefully working through this process. I will make sure personally that she is updated around this work. It is something that she, alongside the Mayor and others in her community, but through her leadership and advocacy, have been pushing and calling for some time. And I know it was an issue and a challenge that the former government faced, and it is an issue and challenge that we are. Now, I've asked for a significant piece of work to be done to examine this in relation to these integrated health hubs. I think they can work. They can work in certain parts of the outer suburbs of Sydney, particularly in large growth areas like southwestern Sydney, and I remain committed to making sure that the member, and through the member, her community is kept informed about the progress we are making and the importance of delivering better health services for her community.